Alright, let's go. Today we're going to be talking about generalized anxiety disorder. And before we go any further, imagine yourself a situation you're approaching your front door and you're reaching for your keys, but you cannot find them in your backpack. You dig around for a few seconds, but you still cannot find them. Before you know it, you feel a bit of panic. You check in every single pocket you have. You start thinking about all the places you could have lost your keys and how you're going to explain that and how you're going to get through your day. If you've had this or similar experience, it may have felt as if no matter where your mind have wandered, it found a problem to land on. Perhaps your stomach hurt or you were exhausted after this happened. Now, imagine you felt that way all the time, for months upon months, even when everything was going well. That's what it might feel like to experience generalized anxiety disorder. So let's see, what is it? It is an anxiety disorder marked by unpredictable and excessive worry, which is not linked to anything particular. And people who have it find it really difficult to control it. Sometimes anxiety is described as free-floating, meaning that it's gonna float and stick to anything and infect it with the thoughts of worrying. The generalized anxiety disorder is associated with both psychological and physical symptoms, such as restlessness, fatigue, concentration difficulties, irritability, muscle tensions, and sleep disturbances. And this is not just a rough patch. For a diagnosis, symptoms must be experienced for at least 6 months, although many people experience them for much longer. People with GAD are persistently tense, sometimes so much that their muscles become really sore. They are very sensitive to stressors in their environment, and of course it is really hard sometimes for them to maintain the concentration. What makes them tense? Nearly anything. However, the most common worries that occupy their minds are bad things that could happen to their family, their chores, their kids, work, things that needs to be done on time, their performance at school or work, almost anything. A vast majority of these worries, around let's say 90%, turn out to be needless. But for people with GAD, it becomes a total catastrophe. The anxiety creates more anxiety and it creates the problems in their work and social lives. In the end of this video, I'm going to give some tips and techniques which you can use on a daily basis in order to reduce that anxiety and alleviate the symptoms. How often does it happen? According to EPA, around 6 to 9% of the US population meets the criteria for generalized anxiety disorder. The mean age of onset is 24, a bit higher than for some other anxiety disorders. And it appears to be more common in women than in men. The fight, flee, or freeze response is a biological response we all have. Many of the symptoms of GAD are symptoms of this response. But people with GAD are so prone to anxiety that they have this fight, flee, or freeze symptoms even when there are no actual threat. Now, why do people have it? Of course, generalized anxiety disorder tends to run in family. The heritability of this disorder is around 30%. It's a lot. People with GAD show more activity in their amygdala. It's an area in brain that processes emotions. This disorder can also be the consequence of the early relationships between children and their caregivers. For instance, overprotective parenting can lead to higher levels of anxiety in kids. I remember one of my clients who had generalized anxiety disorder, and when I asked him about his childhood, the way he was brought up, he basically said he didn't have a nice childhood, not like as a normal kid at least. He didn't have that support from his parents. And we're not speaking only materialistic support, but also emotional support. When the kid doesn't understand if his mother loves him or she doesn't, when they're not there for the kid. That's why when we talk about person history, his disorders or syndromes, whatever the case may be, it's not only about genetics, it's also about environment. And this insecurity, which a young kid has, this instability brings him to the consuming different substances, drugs, maybe later on in the teenage. When people grow up, they find themselves in destructive behaviors such as alcohol abuse, drugs, or anything other. And basically, this is a game with no end because it leads only to a bigger destructive behaviors. They may find a nice partner, may not. Imagine in case they don't, then they're going to give a birth to a kid who is going to have a really high percentage of possibility to inherit this disorder. And even if it's not genetic, it's going to be by environment, because these people have different patterns, the way they think and the way they react to different circumstances, different situations. That's why they say like mother, like daughter. So before you go into the relationship with somebody, you should meet up with their parents first. People who provide a secure home base from which to explore the world tend to have children who more readily feel a sense of control over their environment. Snowplow parents, in contrast, protect their children from any harm, so the children may develop in an environment where their skills are never tested. As a result, they may feel lack of control over their environment. How is the generalized anxiety disorder treated? So normally it goes both medication and the psychotherapy. Normally it's CBT. Don't confuse it with CBD. What type of medication? It can be benzodiazepines or SSRIs. It depends on a few factors, such as sleep or level of anxiety you're having. Benzodiazepines can be helpful in the short term, but they do have a lot of disadvantages. Pretty much as any other pills, you should know that yes, they're helpful, but it's obviously not a magic pill which gonna relieve you from anything and treat you. So yeah, very careful with it. And just simply because people can build up a tolerance to this medication. Benzodiazepines can also create problems with thinking and motor functioning, which could cause problems while driving and leave older adults susceptible to slips and falls. So because of these limitations, many prescribers use benzodiazepines cautiously. When we speak about psychotherapy, different types can be useful, but normally the main one is cognitive behavioral therapy. And there also was a study that shows that short-term psychodynamic therapy has had more success in reducing anxiety symptoms than a traditional psychodynamic therapy. Learning perspective suggests that psychological disorders are learned behavior. That suggests that all anxiety can be learned and also maintained through learning. In reality, a lot of biological and psychological vulnerabilities can predispose people to have DAD, such as those who have difficulties with uncertainty and find it hard to tolerate the potential negative consequences of future events. Because of this susceptibility, people set up the ways to protect themselves. It is also known as hypervigilance. Nonetheless, it's not always a bad thing. Obviously, we're not talking about the disorders right now. So basically, because exactly of this hypervigilance, you're driving more safely in the storm, you're being more cautious when you're crossing the street, for instance. It is a really nice personal trait which not everyone has. Anyways, how do we reduce anxiety? So one of the techniques I use on the session is that I suggest to the patient that, let's say he comes and he's saying, oh my God, I have the anxiety the whole day, literally. I wake up, I'm worried about something. I go to sleep, I can't fall asleep because I worry about something. So we set the time when he is actually able to do this technically. So you're sitting and you're thinking to yourself, okay, how much hours I'm going to give myself to worry? Let's say, all right, I need to do this work, I need to study this chapter, and then from the time from 12 p.m. till 2 p.m., I'm going to give myself time to worry. So during that time, you sit and you worry, like, oh my God, what about my job? What about my exams? Whatever the case may be. So basically, you're telling yourself, don't worry, you will worry, you'll have time to worry still. Let's just do these dishes, and then we're gonna go and worry. Then we're gonna go and feel anxious about something. Let's just do this one thing real quick, and then we're gonna go. You see how that works? Let's say you're setting amount of hours you're going to worry every day. And obviously it's going to decrease with the time. For one day, you allow yourself to worry around 4 or 5 hours, hypothetically. Other day, it's going to be 4, another 3, 2. It's not going to be like the whole week. You will reduce anxiety. It's not possible. But with the time, in some weeks, it's going to work out. Let's move on. You will laugh, but I strongly suggest you to use lavender. Lavender has been used for centuries to calm and relax. So you can have some baths, gels with the scent of lavender. These essential oils can be added to the perfumes or something you spray on your pillows. They're actually specific lavender sprays. People normally use them before they go on a plane to sleep better. Many people use alternative medicine and herbs because they're natural and lack side effects. But essential oils such as lavender do have side effects when it's ingested. Okay. So another key information here. So when the patient comes to me, we normally work with his perception. Because when you're worrying about something, when you're anxious about something, you might be thinking about some potential danger which might actually happen or may not. And it's obviously connected with your emotions, the way you perceive some situations or people. You should understand that there is a difference between perception and perspective. Perception is something that you perceive with your 5 senses, let's say vision, sense, and etc. And perspective is when you add some assessment to your perception. You can hear a lot these days, you should trust your emotions. In reality, you should not. Because if you trust your emotions, you're basically trusting your perception, which is very limited. It is fine to experience different types of emotions, they guide you, but you should not use them to make your final decisions. So if you always follow your emotions, that means that emotions are in charge of you. They have a control over you and not the otherwise. That's why on our psychotherapeutical sessions, we are learning how to cope with this all anxiety. So in case you have this diagnosed anxiety disorder or any other anxiety disorder, please let me know in the comments how you cope with it and what helps exactly you, what works for you. And in case you want to have a consultation with me, just send me a DM on this Instagram. See you in the next video.